Hi, my name is Rachel, and today is Sunday the 5th. And I'm here just to kind of tell you a little bit about my experience of what I'm going through at the moment, which is papillary carcinoma of the thyroid. I was diagnosed with thyroid cancer about a week ago. The biopsy came back, and I don't really know what else to say because that's pretty much all my experience right now. I probably noticed a lump in my throat about 2 years ago. I didn't really do anything for it until I got pneumonia about a year ago, and the lump in my throat was making it hard to swallow, with the pneumonia having caused swelling of my esophagus. So I went and got an ultrasound done, and they said it was pretty large and looked what did they call it? Suspicious. It was large and suspicious, and they immediately wanted to remove this lump. I saw an ENT, and I'm a single mom, so surgery wasn't the highest priority at that point. And they just said that it could have been a thyroid problem. They didn't do anything, didn't say anything about cancer, just said lump in your throat. Let's remove it. Maybe we'll take the whole thing. Maybe we'll take half. We'll see once we get in there. But I didn't do it, and I got a different job, and things got a little crazy. Moved in with my boyfriend, just, life. And then this new job came along with health insurance, so I decided to go get a second opinion. I went to another ENT. They wanted to do another ultrasound to compare, and they said that it had grown just a little bit. They also found another smaller lump or goiter or node, whatever they're calling them, that was a little bit higher, that had grown substantially since the year before ultrasound. And then he said the same thing without any other tests. Let's take this guy out. You will schedule a lobectomy of your thyroid and send it to pathology. If it comes back cancerous while you're under, we'll take out the other side. If it doesn't come back cancerous, we might have to do more tests. You might have to come back a week later to take out the remainder of your thyroid. And so I scheduled the surgery, and I happen to work for a medical doctor. I'm a practice manager for a neurosurgeon, and I told him about it, and he said, "What the heck are you doing seeing an ENT for your thyroid problem? Go see an endocrinologist," and gave me a name. I went to go see this guy, and he's basically confirmed everything everyone else said, but he wanted to do a FNA, or a biopsy, fine needle aspiration. We did that. It was kind of rough. I was scared. I've never done anything medical in my life before. I have 3 kids, and I did them all midwifery, no drugs, no doctors. I'm not really into that stuff myself. I worked for a chiropractor for 5 years, very holistic naturopath type of things that I do. Yes, I eat Taco Bell, but I don't shoot my kids up with vaccines, so things like that. So I was a little scared about the thought of a biopsy. I'd never done one before. It was an ultrasound-guided biopsy, so there was a radiologist there and the internist who did it. So we had one working the ultrasound machine and one working the needle. I had no idea what to expect. I thought needle going in, then going out, but it was 6 needles going in, and they were kind of like, they went to my thyroid lump, and she put it, and then she was kind of jabbing it around in there. I was completely numb. I didn't feel anything, but because my lump is so big and right under the surface of the skin, they could only do one of the numbing shots. They didn't do a deeper one like typical, because they would have actually entered the mass that they were trying to biopsy. And that's what just came back. It took about 2 weeks for those results to come back, and it was what they call papillary carcinoma, which is a thyroid cancer, one of the less aggressive of the thyroid cancers, which basically means that they're going to go in and take out the whole thyroid, make an incision, take that puppy out. I don't really know what's going to happen from there. I've heard things about radioactive iodine. And those actually kind of scare me more than anything. You know, of course, there's going to be thyroid medication for the rest of your life, depending on if they can save the parathyroid glands or not. Then I might have to do something about calcium. They try to save a parathyroid gland or a piece of a parathyroid gland because that is what produces your body's calcium, which is a little harder to maintain than producing your thyroid functions. So we'll see. Like I said, today's the 5th. My surgery is on the 9th, this Thursday, and I will talk to you guys probably before then, maybe after the surgery, but you'll see me in a few days. I've got high hopes. I think that everything's going to be fine. I ended up getting 2 general surgeons rather than a general surgeon and a assistant surgeon, so I've got 2 of the best surgeons available up here in Alaska to me. Unfortunately, the one that's done most of the thyroid surgeries in Alaska just retired this year, so I missed out there, but these 2 surgeons were recommended by him, so I feel like I'm in good hands. I'll be able to take some time off of work, or at least I won't go to work. I'll work from home. Shh, don't tell anyone. They're trying to tell me I need to rest. But thank you for listening, and I will talk with you soon.